So
Oh,
not
wow.
travel PT, not home health.
Uh-huh. Uh-huh.
Definitely more unique and niche. So I,
Yes.
with another business owner, so we're a team of two, and think of van life where people are converting vans. I imagine in San Diego, there's like mobile dog grooming, there's mobile car
Mm-hmm.
detailing.
Yep.
There may be a mobile PT, personal training or physical therapy. So
Uh-huh.
I have a mobile clinic. So think of like a clinic on wheels that comes to you.
Hey everyone, Gerardo here, physical therapy student and founder of Rotate Clinical Housing Solutions. Are you stressed about clinical rotations? Don't worry, we got you covered. We're diving into real talks with PT pros to help you thrive, not just survive on your next rotation. Today we're talking to Gabby, who's a DPT, mobile PT guru, and NPTE coach. She has a lot of experience in different settings and a lot of real world advice you don't want to miss out on.
It's a two-part question. Your current clinical experience, I know you've been there
Mm-hmm.
for a month, but what
Mm-hmm.
are some of the things that you've learned about yourself or your CI that may have been different than previous clinicals?
I just finished, I think, week 6 of my clinical rotation, and it's 12 weeks total. So I'm kind of at that halfway point. I'm at a outpatient orthopedic clinic. I'm enjoying it a lot. It's really close to home. And currently it's just my CI and I, since it's a newer clinic with that company, older company, but new clinic that was just opened. So I'm really enjoying just having enough time for each patient, and really having that one-on-one coaching. We have very similar styles from what I noticed on the first day, in terms of like how she's providing some of the feedback. We're just like taking me on at the end of the day and just giving me a little recap. And I just, I'm enjoying it because she's also very busy and I'm busy, and I can see her very much has a good connection with every patient that comes in. She's been at the location for, or that community for a while, so she knows every middle school, high school, people who work in firemen or police officers. She knows a lot of people, so it's just awesome to be in a clinic where I really do see that connection from like to visit.
Oh, I love that. And then what about your previous clinical experiences? Have you
Mm-hmm.
had good, even from the previous ones, have you
Mm-hmm.
ever encountered a CI where they gave negative feedback, or has it been majority pretty good so far?
Yeah, the first rotation, I was also in a very similar outpatient orthopedic sports. And then my second one was at the VA hospital for inpatient. Very completely different experience, aside from how different the experiences are, because for me, I think the inpatient was a lot more difficult, just pre-charting and just being a lot more sensitive to just the patient environment, the rooms, how everything's set up. I felt like it was difficult in that sense, but as far as my CIs and the support I received, I was pretty fortunate to have people that I was able to connect. And I think they've been doing it for a while, which definitely helps. They've seen a lot of student like styles of learning. But then I also think part of it is also myself, because I know everything is temporary. So I try and adapt as best as I can. And that's even with just my courses in DPT school, because I know we've had professors that have different learning styles, and I just try and adapt to it as best as I can. Because even in the real world, you'll get patients from different backgrounds, obviously, different conditions. So it's just part of the profession. You just got to be very, very flexible. At least that's how I see it.
Oh, I love that. Oh,
Yeah.
yeah, that's so important. The clinical experience are just really great to reflect on. And then even when you're a
Hmm.
practicing clinician, you'll take some of what you learned in those different environments and then
Hmm.
apply it to your personal practice too.
Exactly. Cool. Do you have any other questions? I know I had I had a few
Oh,
questions as well, but you
yeah.
can go ahead.
So I want to know the origin story of your business, the
Mm,
clinical. I have never heard of that before, and it's so unique. And so I want to
mhm,
hear the vision. Why did you start it? Because that's really, really good, especially as a student. It is
mhm.
not easy to do that as a student and then working and doing all of that.
So Rotate Clinical Housing Solutions started, I'd say the idea came on my first rotation. So I go to my PT school is University of St. Augustine, the one in the San Diego location, Southern California. And I got placed initially maybe an hour away or so. and then my rotation got canceled, and then I ended up all the way out in Seattle, Washington. So obviously, brand new place. I visited once as vacation just to tour the area. I knew it was going to be a lot different going there and actually living there for a few weeks, especially with a full-time schedule. So I looked at Airbnb, I looked at Furnish Finder, I looked at a bunch of other housing locations, and me being a pretty experienced traveler, I've traveled internationally, I've traveled around the US. I thought it's going to be fine. It's only a few weeks. Get to an Airbnb, and it wasn't what I was expecting. Like I mentioned, it's just a whole different experience trying to have a comfortable living situation when you are working your 40 hours a week, basically treating patients, and then on top of that, doing schoolwork, just preparing for the next day. There's that added stress of being a student and working full time, which I wasn't used to. And the last thing you want is to come home to a place where it's not supporting your experience. So I ended up midway through my rotation having to move out because of the housing conditions and just roommates. It was in a house with multiple other roommates, and I ended up moving to a new location, and it's just not something I thought about, having to move within your rotation. So in that first rotation, I thought maybe it's just me, maybe it was just a bad experience. Go to my second rotation, I got placed out of state again, so brand new location, had no idea anybody in that area. It was in Phoenix. Luckily, Phoenix is a pretty busy area, and they got young. There's colleges nearby, so I found housing as well. I think it was through Facebook, just housing groups. Get there for a few weeks was okay. Obviously, there's the stress of adapting to a new community, a new environment, and then the same thing happened. Some of the living situations weren't as clean as I thought. Um, it was kind of the same thing again, and I was like, oh, it's only a few weeks, but in my mind, I was like, oh, the first time I'll give it the benefit of a doubt. It was just an experience. The second time, I was like, no way. There's got to be other people experiencing similar things that I am, and nobody's talking about it. Nobody's really saying it. And even in my program, talking to other professors or even other PTs who I worked at as techs and stuff, they've mentioned you got placed in this state, I got placed out here. And the narrative is kind of just you're there temporarily, you just deal with it. But in my mind, there's got to be some tools. There's got to be something to support people that are gonna go into that experience. That way, they don't have to experience what I did. So then the idea came: we can provide clinical rotation tips to guide students through that experience wherever they are, whether it's first rotation, second, third, or even if they're preparing housing tips to let them know, like, okay, yes, it's temporary, but there's certain things you should probably be looking at in terms of like safety, roommates, commute time, what's going to happen with your own lease when you leave, and then overall just supporting the whole experience and providing a space to even have the profession connect with one another, because it is a small world. And in the end, I do hope to see it more as a space for mentorship as well, so people can share their experiences. So that's kind of what was a precursor of starting this whole business.
That's amazing and just so needed in the profession. And when you are graduated, how do you see it evolving? What kind of vision do you have for the business? And if this is something you want to partner with schools, or with other PT groups, because I can think of so many different avenues this can go into. And so I'm just curious from your perspective.
Mentioned it right now at the moment, it's I'm seeing a lot of people engaging and showing interest in this. So I do feel that it's needed in this space. As far as what I see, where it goes in the future, like you said, I have a lot of thoughts, but one of the first things that I think of is like mentorship, especially for students making that jump from student life to PTs. And I know it'll differ based on where your rotation was, or even where the company is that you're going to. So I know some companies offer a mentorship during their like probation period, but then there's people that jump in from setting to setting, or they go completely different settings, home health or travel, and they don't have as much background. So I think right now it's just being an image of mentorship, and like I mentioned, just having that space where other people can start having that conversation. Like I don't think it's being had or taken enough. It's kind of one of those things where they think it's just part of the program. And each DPT program, they do a great job of preparing us to take the boards, go out on rotations, but it's just one of those things that isn't talked about enough, and it's a big part of your clinical rotation experience.
Huge part. And if
Mm-hmm.
you ever want any advice, so I did that. I went
Mm-hmm.
from North Carolina to Tucson, Arizona for my last one. And this was during
Big
COVID.
difference.
Big
Oh,
difference.
wow.
Yeah, this is in COVID. So I fortunately, was living with a friend for the
Mm-hmm.
first 3 to 4 weeks. This was a
Mm-hmm.
12-week clinical. And then her landlord found out that I was living there, and she's like, "You can't have this girl here." And my friend didn't know that. So then I
Uh-huh.
had to scramble and find an Airbnb, $700 for that duration. And luckily I got placed in a home like in the mountains, and
Mm-hmm.
the woman was like my grandmother, and
Mm-hmm.
she was just awesome. Like, again, every experience is different, and that's why it's
Mm-hmm.
important, because you never know what's going to happen.
Mm-hmm.
So yeah, just love that, because your professors are, I've learned now being out of school for 3 years, is professors are there to help you pass. And that's really it. Like, make sure you pass your
Yeah.
classes, pass the boards, and then you're out. They're
Yeah.
mean well, but they're not going to help you, find housing and doing all
Yeah.
that. Like, that's not their job. Their job is to place you in the clinical rotations, but the housing
Mm-hmm.
is your responsibility.
Yeah.
Yeah. Having a resource like yours would be amazing. Yeah.
And initially when I went on any rotation, I getting around with myself, like I've traveled, I've done international travel. I'll just, cheapest space, and I'll just go to the gym and shower, do this and that. And once you're out there, it's like you want to almost protect your what it. Every day you're expected to show up, and every patient you're expected to come at 100%, of how the patient is feeling. They come to us, and we have to be 100% and give them the best treatment we can, or even just listen to them. So obviously what we do outside of the clinic affects, next day's work. If there's anything you can do to be as comfortable, as prepared, as stress-free as possible, all add up. And then once you're on rotations, these make goals to pass that rotation so you don't have to do it again. And for a lot of people like myself, this is my last rotation, and a lot of what I do, and a lot of the performance I bring to the clinic has a lot to say on whether I pass or not. Because in my mind, I'm already looking towards graduation in the next few months. So, scenario is something that I do not want to happen. Yeah.
That. Oh yeah.
Yeah.
Questions did you want to ask? Yeah.
Some of these you've actually already answered.
Oh, I did? Okay.
Yeah, I was
Go over them again,
I'm just curious on where you actually went to PT school, and what were your clinical rotation sites, like setting wise.
Yeah. So I went to PT school at High Point University in High Point, North Carolina. And
Mhm.
my settings were outpatient ortho, acute care in the cardiac department, and then another outpatient ortho and neuro. So my last
Wow.
clinical, so I would say 80% outpatient
Mhm.
ortho, acute care. This was pre-COVID. This was the fall before COVID. And then my last one was outpatient and neuro. So I
Uh-huh.
got a split of both.
That's pretty. Yeah, that's a good mixture of settings.
Yeah,
Um,
it was. I did it. Especially the last one in neuro too.
mhm.
I did my CI number one,
Mhm.
and just the who I got to work with and work his brain,
Mhm.
and that made the last one so much more enjoyable.
Yeah, yeah, I would imagine. And did you have a say in your selection, or how did the school prepare you, or um, did they have a say in where you wanted to go?
Yeah, so we had at the beginning of our rotations, we had a 7 week, was it 2 7 weeks? Yeah, we had 2 7 week rotations in our first and second year, and they were half days. So it would be like 8 to 12, and then you would be done, because we had electives. So say if you were
Mhm.
taking dry needling, then in the afternoon you would do your dry needling class. So first two were picked by faculty or our clinical placement team. And
Mhm.
then the long-term rotations, so our 12-week rotations, we did a lottery. So what we did is pick a number from a hat, and whatever number,
Wow.
say if you were number 20, then
Uh-huh.
number one obviously get the first pick out of this whole list of clinical placements with their
Mhm.
location, their if it's outpatient inpatient, whatever it is.
Mhm.
And that's how we did it for the long-term one. So we got, it was a lottery, and my plan was to, I think I actually set this in place, but I was living at home for more than I wanted, but it was good because it was still during COVID.
Yeah.
So lottery, I got that. And then my last one also was a lottery, and no one wanted to go to Arizona during COVID and travel. So I
Mhm.
wanted to. And so I got one. So yeah, the lottery system.
Yeah. Wow, that's interesting. It's
Mhm.
like a two-part kind of clinical process for one program.
Yeah, exactly. And they get a fun day. So
Mhm.
it looked like this year's cohort, they did wear your favorite sports jersey, and then it's like a whole party, this whole lottery system.
Mhm.
And yeah, it's like a, your last clinical placements
Mhm.
type of bill, and it's a celebration then, like, oh, and people were disappointed, but for me
Yeah,
personally, I got what I wanted.
that's awesome.
Yeah.
And what is a few rotation or a few settings? What is your current setting that you're practicing in and led you there?
Great question. So right now I'm in outpatient mobile physical therapy. So
Oh,
not
wow.
travel PT, not home health,
Uh-huh.
definitely more unique and niche. So
Yes.
with another business owner, so we're a team of two, and think of van life where people are converting vans. There's in San Diego, there's like mobile dogging, there's mobile car
Mm-hmm.
detailing.
Yep.
There may be a mobile PT, personal training, or physical therapy. So
Uh-huh.
I have a mobile clinic. So think of like a clinic on wheels that comes to you.
That's
And
awesome.
so I on this specific niche clinic from travel PT, and I was going to do travel PT when I graduated. And then
Mhm.
once I found this opportunity, I applied, I was accepted. And yeah, now this is my third year,
Mhm.
and we're cash based out of New York, and
Mhm.
I've been loving it. So I get to see no more than four, well, usually for me it's like, yeah, 5 people a day.
Mhm.
uh yeah, so I have to work with primary population are outdoor enthusiasts, so cyclists,
Mhm.
runners, pickleball players,
Mhm.
cricket. I'm with someone who plays cricket, and then I also do pelvic floor. So I work a lot with women and pelvic floor, um, postpartum, intimacy, leakage. So I'm focusing
Wow.
on the women's health side too, with bringing
Yeah.
mobile care to them.
Wow, that's awesome. You do a
Yeah.
lot.
Yeah. Yeah.
I'm curious to see what your mobile like setup looks in your, you have like a van, travel van.
Yeah, yeah.
Wow,
So I'll
that's
send you a picture of it. And I'll see the link. But yeah,
mhm.
it's PT, and there are only I would say there's probably maybe 8 to 10
Mhm.
of this model in the country.
Mhm.
So the owner, he started it, and hence the name Pioneer. But he was the first to have this vision of building out a
Yeah.
mobile clinic in a van, like in a center van. So
Mhm.
yeah, it's really cool. And I know in California, I feel like it would work well. However,
Mhm.
you would have to be like posted up place, like if you go to the beach and
Mhm.
work with any
Mhm.
individual. But driving the thing, I imagine in California would be interesting. So yeah,
Uh,
yeah.
awesome. Well, thank you for sharing. That's so you have a lot of experience, a rich experience from different settings, from program during PT school, even outside. Um, that's really exciting.
Yeah.
This is going back for maybe students who are just going into PT school or prepping for clinical rotations. Given just how much experience you have, what is something that you think is often like overlooked during clinical rotations?
Yeah, that's a great question. I think something that can be overlooked, which I talked to you a little about, is
Mhm.
the learning style.
Mhm.
And make sure whether it's like a little to know you form
Yeah.
or something like that. And I think I'll say another part to that is getting to know your actual team. So if
Mhm.
you your CI, but then majority of the time you're working with other physical therapists, potentially OT, speech.
Mhm.
And I think something that's overlooked is, maybe with them too.
Mhm. Mhm.
And again, how you work as a whole interdisciplinary team.
Yeah.
And I would say, I don't want to say it's overlooked, but definitely somewhere to focus on.
Yeah.
And another thing too, which happened in my clinicals, is when my CI wasn't there, I was with someone else. And you do need to make sure that that specific PT also knows
Mhm.
like you and doesn't just grill you. Because that happened to
Mhm.
me. I got
Uh-huh.
grilled with
Oh
a PT
gosh.
who I was with. And I felt so embarrassed because I felt
Mhm.
like I couldn't answer the question. And again, that's just not my learning style. Being on the
Mhm.
spot is not my learning style. So
Yeah. Yeah.
it's another area of overlooked of, yeah, just be adaptable.
Mhm.
And I'm trying to think of another, oh, I guess documentation.
Mhm.
So I don't want to say it's overlooked. However, when you're first starting out with documentation, there's a certain system you have to learn. You may have to put some additional hours, at home, but I remember I would come home with documentation and I would just say I'm finishing an eval. And when I'm home, especially goals and working full time, like
Mhm.
you don't do anything. You're just so
Yeah.
tired. So if you are able to get the documentation done at the clinic, even
Yeah.
if you're the last one to leave, if you're able to do that,
Yeah.
just initiation of that, clinic, and then when you're home, you're for the day. So I would that may be overlooked, but just don't
Mhm.
feel like you to feel pressure to take documentation home because you're working
Mhm.
for free, like
Yeah, I definitely agree on the last point, especially because I'm in a rotation right now, and as I do, keep it my notes, or I want to be prepared for the next day.
yeah, definitely.
And like you mentioned, at the end of the day, we're not being paid.
Yeah.
But then I do tell myself sometimes, like, I'm learning. This is kind of
Yeah.
helpful. So,
Yeah.
this is kind of like kind of say, yeah, I definitely see maybe new students or new grads having difficulty, putting between those, and it's helpful
Mhm.
to have others speak on this. But I also wanted to agree on your first point where it's important to get to know the staff.
Mhm. Yeah.
Just seeing that comment brought back a memory of one of my rotations, and during a few weeks into it, I learned that they actually had a student like end their rotation, and I think there was maybe like a week two in between when I showed up.
Uh-huh.
So this they're also seeing like a graduate, a person showing up,
Yeah.
a brand new student with a
Yeah.
different learning style, different backgrounds. Um, so it's one of those things where it is overlooked, but if you put in the time to get to know the staff, like or see what their interests are,
Mhm.
um, there's really not a lot of like to know people at the end of the day. If anything, you can network, and you get to learn, if they're with you, and they see that you're eager to learn, respectful. A lot of times they'll teach you brand new skills and like ways of doing things that maybe your CI does differently too. And at the end of the day, you can kind of pick what you want to stick with after you leave that rotation. So
Yeah.
I'm glad you touched up on that. And then going back to the multiple CIs and said because you've had a lot of mentors, and I was curious, is there any specific piece of feedback that you received from like any of your CIs that have been very impactful or that you incorporate till today in your own practice with your mobile clinic?
Yeah, so I would say the biggest piece of feedback, I'll say one that was positive, and then one at the time
Hmm.
I needed to improve on for,
Hmm.
I don't know if you still do the CPI, but this is
Yes.
a whole long thing. Yeah, the CPI. So one that I consistently did well was interacting with the patients, seeing them for their whole being. I never just labeled someone as a number.
Hmm.
I was very connected with them. I remembered little details about them.
Hmm.
If they said, like, I remember some of my patients from my last clinical rotation,
Hmm.
and there was one couple in particular, and they were snowbirds. So they were, I had a lot of individuals who spend half of their time in Arizona in the winter.
Hmm.
And so just getting to know them and their families. So I would say one thing I did really well was like remember and making the person who I was working with like feel seen, heard. So
Hmm.
consistently, like that was a strong area for me. I think one area that was needed to improve on was my clinical reasoning. I
Hmm.
always got asked why I was doing an exercise, why I was doing a certain technique.
Hmm.
And sometimes that would really like throw me off because I personally didn't feel I had the clinical reasoning
Hmm.
skills.
Hmm.
And to be completely honest with you, everything finally clicked. Like after I was practicing for 2 years. And now practicing, I'm year 3 into my having my license, and I don't feel like a new grad anymore. I'm always learning, but
Yeah.
I can do an eval, I can treat someone without having to overthink. So I think one area for me was I overthink too much, and that was definitely something I still take to this day. And it came with reps, it came with just processing what I'm doing. And again, more so from the aspect of, okay, why am I doing this joint mobilization? Like, what is it connected to? Looking at other areas of the body, that sort of thing. So, yeah, I take those to this day still.
Wow. Wow. Awesome. Thank you for sharing that. That was a
Yeah.
lot. And that was, I your honesty, because, a lot of people need to hear that. What you said is, after you graduate and start practicing, you're doing the job of a PT, but, something like you're not there yet. And for you, you said, it took 2 years. I know personally as a student, when struggling, it's mainly in PT school leading up to boards. And after you pass, we have this image that, okay, you passed, so you must know you must be good to comfortable. But hearing it from you, at least for me, it was really reassuring that, I process, because I do have days where I'm like, why am I doing this? Or like, am I doing this technique right? Or, or even if I'm educating a patient on something, I was like, I hope I explained it correctly. But just hearing it from you, that would be powerful.
Yeah.
um,
It's
yeah.
it's a learning process. You'll learn how to
Mhm.
say things to a patient that makes sense. So I
Mhm.
will give you this little tidbit of now, and actually starting this year, I started using analogies and metaphors to describe,
Mhm.
patient-friendly terms. Like I don't start in terminology because it can be fearful.
Mhm.
I'm not saying I that, but I'm just being more aware of my communication. I would say that's the big
Yeah.
area of improvement is communication. And whether it be you're telling someone, what's on, or you're walking them through their exercise. So,
Mhm.
yeah, huge improvement for myself. And I think for a lot of
Mhm.
students comes with that communication
Mhm.
standpoint.
Wow, that's awesome. Cool. Well, I think that was the last question I had. I don't know if you had anything else you did
I'll say
want to
one
just.
more thing. Also, so I want to talk about this in the sense of the NPTE,
Mhm.
because I still think there's some pressure, we'll say, pressure
Mhm.
around taking boards ASAP. And what I mean by that
Mhm.
is feeling pressure to start your job, start making
Yeah.
money, and studying during your full-time clinicals. Now, some individuals really excel with that.
Mhm.
They their first try, they did pretty well with their exams in PT school, and they're able to handle the pressure and the load of clinicals, study, life outside of that.
Yeah.
Pass on the first try, you're good. But for those who say didn't do very well with their exams in PT school, they find they get test anxiety, and they're
Mhm.
like, I don't know, I can't wrap my head around studying, moving across the country to do my clinical placement, potentially finding housing that I have to move out from.
Mhm.
And then we'll also, again, like do a thing. So just don't feel pressured to take your boards right away.
Mhm.
You can wait. And I know it may seem counterintuitive of like, well, I want to start making money right away, but I
Mhm.
want to start paying my loans down. But if you know yourself and you know that you don't excel under extreme pressure, then
Mhm.
just wait the extra 3 months to take your boards. Like, don't feel you have to do it during clinicals.
Mhm.
Um, that's just a personal mistake that I made because I took boards for the first time. I was moving back across the country, and I
Mhm.
had graduation all in a month's time.
Wow.
So
Uh-huh.
I just like put that out there too, because
Yeah.
I know too many people who don't pass on their first attempt because they put too much pressure on themselves by
Mhm.
doing all
Mhm.
those things that I mentioned.
Yeah.
Yeah.
That's good.
Yeah.
Like, I hear the opposite. Like, just, in our head that we just want to finish, we want to start making money.
Hmm.
The end goal is, passing the boards. But
Yeah.
we think about the time frame. I'm currently in the moment of like, okay, child graduation, first job, and well, to be honest, they've been in school for a while, and it's like I want to take like a vacation, but it's,
Yeah.
it's that when you're having everything stacked like you mentioned
Hmm.
in your situation. So, um, Yeah, that's something to think about.
Oh yeah, for sure. And if you're passing your practice exams, if you're taking
Mhm.
practice exams and you're like passing quite a bit, like, okay, PTE, but
Mhm.
yeah, I'm talking to those who don't necessarily do well on those
Mhm.
type exams. But yeah, again, important. And you
Yeah.
need a break. You just spend
Yeah.
so much time like in school.
Yeah.
So yeah, you definitely like just take a break.
Yeah. Yeah,
Yeah.
and I think it's important you mentioned that this requires each individual to check in with themselves
Yeah.
because the boards again, perfect good job of preparing you for each class and
Mhm.
those NPT, but the actual act of studying for the NPT can be a little independent, lonely, and people will see that their cohorts, a first test coming
Yeah.
up, so they might do the same without really checking in, like what is my situation look like at this moment, that you brought that up.
Yeah. Well, thank you so much for this conversation. I am so glad. And yeah, thanks for questions. They were really good to like reflect back on.
Yeah, yeah. Just to close up, where can people find you if they have any other questions or if they do want to connect or follow along your journey with the mobile PT that you offer?
Yeah, so you follow Pioneer PT MD
Mhm.
for the mobile physical therapy clinic. And
Mhm.
then for those of you who want to know more about the NPTE, you can follow pass.the.npte on Instagram. And I would love to connect and just help you all out. Um, I will say another plug for those of you who may have heard of it. It's called Gratitude,
Mhm.
Gratitude, Gratitude, the grad school guide for student physical therapists. I believe on Spotify and Apple, it's called the PT Student Center. So you can look up the PT Student Center, it should come up. And
Mhm.
that was a podcast that I co-founded and co-hosted for my whole duration of PT school. So there's a lot of good, still great information,
Yeah.
a lot of really good guests that we've had that are
Uh-huh.
pretty prominent in the PT space.
Yeah.
And you can go, I can drop the link.
Yeah.
We are not doing any more episodes. It's been about
Mhm.
2 year, not quite 2 years, about 2 years since we had our 300th episode, but you can still scroll through. There's so many you can
Yeah.
get some gems from.
That's awesome. Thank you for providing that last plug. I know for any, wherever you're at in your journey, even pre-PTs, like tapping into real life, conversations like that, a long way of kind of what clinical rotations will feel like or what a day looks like. So I would definitely encourage everyone to follow those pages and continue, thank you again for your time, for sharing so much insight. And I'm excited to see where what you got off with your mobile clinic and with what we're doing. It's just small the PT world is to like how we have so many shared similarities and how everything kind of just neatly. So I appreciate you taking the time again to share your experience and your journey.
Yeah, thank you. I did.